One of the earliest signs of coronary artery disease is chest pain. Chest pain called anginal pain, it's called angina pectoris because it occurs in the pectoral region of the chest. And typically in the early stages, an individual experiences pain when he walks or he performs any activity. So that is what is called exertional chest pain or exertional angina. In some individuals, unfortunately, the first manifestation of coronary artery disease is a heart attack or an acute myocardial infarction. So this occurs frequently because of what we call a rupture of an atherosclerotic plaque. So when there is a rupture of the atherosclerotic plaque, there is a resultant clot formation which causes a sudden abrupt occlusion of a coronary artery. So that is a medical emergency and presents as a heart attack. In medical language, we call it myocardial infarction. And when this occurs, the individual has to be treated in an emergent fashion with what we call a primary angioplasty to clear the blockage so that the heart muscle is not damaged. In other situations, coronary artery disease can present with what we call unstable angina. This is a situation where an individual has episodes of pain during over a period of days to weeks. Sometimes pain occurs at rest, sometimes pain occurs on exertion, and usually these patients present in a less acute fashion. They can present over a period with a history of over days or weeks, and then this is often a precursor to a heart attack, and this is what we call unstable angina, and these also need to be treated as early as possible to prevent a major heart attack.